Uh, I'm Anders Eikenes. I've been working on cameras and sensors and algorithms in large companies now for about 20 years. Last company I started was Hudley. It's an intelligent camera in the conferencing space, soon approaching $20 million in annual revenues. But I'm off to build my second startup, Oivi. It's still an intelligent camera. Do you know the #1 reason why working-age adults turn blind? It is diabetes. Diabetes can cause bleeding in the retina, which over time can lead to blindness. But if detected early, it's quite simple to treat. The challenge is the patients don't notice any vision loss, and when they notice, it's often too late to save the sight. That's why diabetes patients should go to check their eyes at an eye specialist once a year. There's soon 500 million diabetes patients in the world, and already 160 million have some sort of diabetic eye condition. The challenge is the existing retinal cameras used for screening today are expensive and difficult to use. And there's simply not enough eye specialists in the world. In fact, in India, there are 11 eye doctors per 1 million people. So this lack of early access to screening is a major cause of this blindness epidemic. In Oivi, we want to solve this problem by making an easy-to-use handheld retinal camera, which automatically grabs an image of the retina to give the patient an early warning if they need sight-saving treatment. This is our current prototype system, where you can see an image of one of my colleagues. We track the eyes with actuators to capture the image fully automatically, and we deploy machine learning running on our embedded neural compute engine on the device to be able to detect early signs of diabetic eye disease within a minute. Oivi will be used in primary care settings, but also in settings like this, which is from an eye screening camp in southern India, which we visited last year. There were 200 patients waiting in lines to get their eyes checked, and the nurse here used a flashlight to check for cataracts. We want Oivi to be like this flashlight to screen for retinal conditions. India is our first market, but we'll later move on to other emerging markets and eventually also Europe and the United States. We strongly believe to create an impact, you need to build a scalable business model. And we plan to launch in India with a pay-per-scan model, charging around $4 per patient. This is the Oivi team. We have extensive experience building cameras from the ground up and also healthcare experience. We work closely with eye hospitals in India and optics partners in Norway and Japan. We've been building the tech for about 1.5 years now, soon getting ready for trials on patients. And we're happy to be backed by notable investors in Norway, US, India, and China, and have raised around $2.5 million to date, half of it through grants. We're now raising another $1 million, matching a new governmental grant. If you think this is exciting, please come see me afterwards in meeting room #1. Thank you.
Yeah. Oh, and actually, you have the Q&A session right now as well.
Oh, yeah, I do.
Panelists.
Thank you. That was a very clear and good presentation.
Thank you.
I'm just wondering, after you've gone to India, what are going to be the next key markets, and how are you going to enter new markets? Do you have to sell to individual hospitals or institutions, or is there a business model you can apply to kind of sell more widely to a new market?
So first step is really to replicate the model we use in India, which is a market which doesn't really have much healthcare insurance or not even much governmental support. So we base our business model on patients paying themselves, and we're finding other markets replicating that. Indonesia, Malaysia, Thailand, very interesting markets. But I mean, we are pulled to the US by advisors there. We just need to wait. Pulled to China by one of our investors there. Need to wait. So we're choosing markets which are easy for us to expand further.
But is the model both B2B and B2C then? Because you have to sell the hardware first, right?
It's a pure B market, selling first to diabetes clinics in India, but also other, primary care, healthcare. Could be large hospital chains as well eventually.
Yeah. Thank you.
Thanks.
Thank you so much to Oivi.